Hi, this is Dr. Leon Scott coming with the second of 4 videos focused on using nutrition as a way to treat osteoarthritis of the hip and knee. We know that if we have a 10 to 20% weight loss over a 2 to 6 month period of time, that is associated with predictable and reproducible improvements in knee and hip pain from osteoarthritis, especially if we are overweight or obese. So instead of using exercise as a weight loss tool, what we are doing is using nutrition, using food as a weight loss tool with one of 4 strategies. So this second strategy is to look at the timing of when we eat. We've looked at the caloric control, how much we eat. We've looked at what types of food we eat, the food composition. We've even looked at things we consume besides food, like drinks, beverages that we take in. But this one is going to focus on when we eat. The key to this strategy lies in intermittent fasting. So when we consume food within the first 2 hours, our body is in a fed state. And during that state, we are using the energy that our body just took in, and we're also storing some of that energy that our body took in, oftentimes as a type of energy known as glycogen. That is typically in our liver, some in our kidneys, and in our muscles. After that time, after the 2-hour point, between 2 and 8 hours, our body starts to change how much of different types of energy it uses. It starts using the stores of energy that you had from the food you just ate. After about 8 hours, that proportion starts to change a little bit more. And that proportion changes so that it isn't using the stored glycogen energy, because that's starting to run out. It's using other stores of energy like fat. And that's what we want in order to maximize and burn those excess stores of fat that we have around our bodies. So that happens typically at around the 8-hour mark. But if we're able to extend that to 12 hours or 18 hours, we can preferentially burn a fat type of energy. Now, we can do this in a few different ways, and it really depends on when you want to eat. So, do you prefer having breakfast or lunch? If you prefer breakfast, you can have 2 fasting periods a day, where you're breaking the fast and having a meal at 6 a.m. and 6 p.m. You're essentially spreading it by 12 hours, getting 2 12-hour fasting periods. You can also move all your meals to 1 6-hour block. So you're having food between lunch and snacks and dinner somewhere between 12 and 6 p.m. That way you have an 18-hour fasting period. Both work well. Now, the key to this, though, is to make sure that you follow some key principles. That way you know that you're sticking to the strategy. So, like with all of our nutrition strategies, there are 4 key principles. Number 1, pick one of the strategies. We're giving you 4 strategies, but don't try and pull all 4 levers at one time. That's going to be difficult to manage. Principle number 1, use one strategy at a time. Principle number 2, we want to have a goal. So we recommend following a 10 to 20% weight loss over a 2 to 6 month period of time. Principle number 3 is you write it down. You get a notebook, a journal, a calendar, and you make sure that you get a red pen and you mark off each day in that day planner or journal or on a fridge calendar that every day you stuck to that strategy. If you can control the behaviors, what we call leading measures, then the weight, a lag measure, will follow behind. The body knows how to take the input of that new behavior and turn it into a weight loss and weight control. That leads to the 4th principle. You do not weigh yourself more than once a month. If you're a patient of ours and you want to use nutrition as a method for treating your osteoarthritis, then you will be able to visit with me each month where we do your weighing for you. No need for a scale at home. But if you're doing this at home on your own, I strongly encourage you not to weigh yourself every day, not to weigh yourself every week. You follow your behavior, your strategy that you're keeping track of in your calendar. the weight will follow. You just weigh yourself once a month to make sure that you're on track. And if you are falling off track or not on track, then you pull a different lever, and that will help get you back onto the on track with the goal that you're set. All right. Hopefully you found this helpful. If you do, please leave comments if we have those available. Like and share. And if we see enough traction with these pilot videos, then we'll make some formal videos for our patients and everyone online. All right. Thanks, everyone.